Previously, in the CNS Pharmacology Masterclass, we talked about the anti-epileptic drugs classification, and we mentioned we have a first-generation anti-epileptic drugs, which are also called the classic anti-epileptics or the older anti-epileptics. And we also have a second-generation anti-epileptic drugs, which are also called the newer anti-epileptics. And Gabapentin is included in the second-generation anti-epileptic drugs. Other examples of the second generation include the Gabapentin, the lamotrigine, the topiramate, the levetiracetam, the pregabalin, and the tiagabine. Examples of the first generation include the phenytoin, the carbamazepine, the valproic acid, the ethosuximide, the phenobarbital, and the benzodiazepines. So in our talk about the gabapentin, we will start with an overview. So a famous trade name for this medication is the Neurontin, and the gabapentin is an analog of the gamma-aminobutyric acid, which is abbreviated as GABA, meaning the gabapentin has a similar chemical structure as the GABA does. And the GABA, as you know, is an inhibitory neurotransmitter that works in the central nervous system. Now, although the gabapentin has a similar chemical structure as the GABA, but interestingly enough, it does not work on the GABA receptors. It works by another mechanism that we will explain later. And the gabapentin was discovered in 1975 by Sazinger and Hartenstein, and it got FDA approval for treatment of epilepsy in 1993. Moving on to talk about the mechanism of action. So the gabapentin doesn't work at the GABA receptors, as we mentioned, but the precise mechanism is not fully understood, but it seems to be related to inhibiting the alpha-2 delta voltage-gated calcium channels. And the alpha-2 delta calcium channels are related to the excitatory neurotransmitters. So when we inhibit the alpha-2 delta voltage-gated calcium channels, that lead to decrease the excitatory neurotransmitters release into the synapse, meaning the gabapentin mechanism of action is related to decrease the excitatory neurotransmitters release. And if you remember previously in the CNS Pharmacology Masterclass, we talked about on how to stop a seizure, and we mentioned we either have to block the sodium channels or we have to enhance the inhibitory neurotransmitters in form of GABA. So we have to enhance the GABA, or the third option is we have to block the excitatory neurotransmitters in form of the glutamate and aspartate. And the gabapentin works on the third option. It decreases the release of the excitatory neurotransmitters into the synapse. Now let's talk about the therapeutic uses. So the gabapentin is FDA approved for the treatment of the post-herpetic neuralgia. Now, the post-herpetic neuralgia is a type of neuropathic pain that occur after damage to peripheral nerves that occur after the reactivation of the varicella zoster virus. The gabapentin is also FDA approved as an add-on therapy for treatment of focal onset seizures and for treatment of moderate to severe restless leg syndrome. Off-label uses means the non-FDA approved uses, and they include other types of neuropathic pain, for example, the diabetic neuropathy and trigeminal neuralgia, and it is not used for sciatica pain treatment because the risk outweigh the benefits, and it's also used in treatment of fibromyalgia-related pain, the bipolar disorder, anxiety disorders, mood disorders, depression, irritable bowel syndrome, alcohol withdrawal, and the headache. Now let's talk about the adverse effects. So gabapentin leads to central nervous system related adverse effects. For example, the ataxia. Ataxia is a disorder of coordination. The patient may have problems coordinating lower limbs movements, leading to trouble in walking, or they would have problems coordinating upper limbs movements, or problems in coordinating speech, or trouble coordinating eye movements. Gabapentin may also lead to nystagmus. Nystagmus is rapid and uncontrollable movement of the eyes, as you can see in this picture here, and it also may lead to headache, tremor, and dizziness, and it may lead to fatigue and sleepiness. And most of these adverse effects mentioned till now occur initially in the start of the treatment and go away with time. Now, the gabapentin may rarely lead to suicidal ideation and Stevens-Johnson syndrome, which is a type of allergic rash, and it also may lead to respiratory depression and rhabdomyolysis. Now, long-term use of the gabapentin is associated with withdrawal symptoms that occur after abrupt stopping of this medication. So if the patient is on gabapentin for a long time, if we stop the gabapentin abruptly, the patient will get withdrawal symptoms in form of agitation, confusion, disorientation, and gastrointestinal complaints, sweating, tremor, tachycardia, hypertension, and insomnia. And dependence also occur with this medication due to the physiological adaptation of the central nervous system to this medication. Now let's talk about the pharmacokinetics. So the gabapentin is available as oral formulations, and the oral formulations are absorbed via the LAT2 amino acid transporter in the upper part of the small intestine. The LAT2 amino acid transporter system is saturable type of system, meaning there is a certain threshold that this absorption system can handle, and beyond that it can't absorb any more amount of the medication. And because it is a saturable type of absorption system, this leads to bioavailability of 80% if only 100 milligrams is given per dose, and the bioavailability goes down to 60% if we use a 300 milligrams dose. And the gabapentin is not bound to plasma proteins, and the full dose gets distributed to body tissues, including the brain, where it produces its effects. And the gabapentin undergoes minimal metabolism, and the dose is eliminated renally with a short elimination half-life of around 6 hours. Regarding dosing, so initially start with 300 milligrams per day and titrate up to 3 times per day of the same dose, meaning 900 milligrams per day. And the max dose is 4,800 milligrams per day. And in renal impairment, the dose should be reduced. Finally, let's talk about the gabapentin toxicity. So with higher doses of this medication, this might lead to toxicity in form of drowsiness, sedation, blurred vision, slurred speech, anxiety, respiratory suppression, and coma, and even death. And with that, we reach the end of this video. Thank you guys for watching. Please support this video by giving it a like and commenting your ideas and questions. And this video is a part of bigger class. It's called the CNS Pharmacology Masterclass. You can check it out if you want.